Okay, Dr. Wieters, I have a patient that I just saw. I want to present to you. Taking care of a 46-year-old female, Miss Smith. She is having a chief complaint of chest pain. She has a history of oral contraceptive use. She has no cardiac risk factors in her past medical history. She comes in with a 2-day onset of a sudden pleuritic chest pain that was in the left side of her chest. It didn't radiate anywhere, didn't go to her back. She had no sort of neurologic symptoms with this. She had no exertional component to her pain. She's not vomiting, didn't have any hematemesis or bright red blood per rectum. Review of systems, she's got no symptoms of syncope, she's got no abdominal pain or back pain. She does note that she has some left lower extremity swelling after she twisted her ankle a few weeks ago. Otherwise, normal review of systems. Vital signs, I went and looked through those. Blood pressure is normal. Her pulse is actually fast at 105, and her respiratory rate by the nurse was 20. When I was in the room, I counted, and I noted that there were about 32 respirations a minute. Her sats were 94%, and that was on room air, and she looks a little tachypnic. On general exam, she looks uncomfortable, but she doesn't look toxic. I examined her heart, lungs, and her abdomen. I couldn't find any real abnormalities from that other than her tachycardia and her tachypnea. Went ahead and did an abdominal exam, no signs of abdominal pain. Neurologically, she checked out well. I think in my assessment, I'm concerned that this lady might have aortic dissection, but I think in my history it's unlikely. She has no risk factors for acute coronary syndrome, and it doesn't sound like that's likely, but I'd still like to get an EKG to be safe. I don't feel like this is a Borja. She's not throwing up. She doesn't look toxic appearing. Unlikely this is a pneumothorax, but we probably want to get that evaluated. When I'm left to consider the possibility of a PE, I think she's at moderate to high risk for that with her history. So I'd like to get an ultrasound of her leg, which on my exam showed the Homan sign. I think we ought to get a chest x-ray to further evaluate her lungs, EKG of course, and I'd like to get a CT angio to rule out a PE. Of course, we're going to need to get a full level of labs with her CBC and comprehensive profile to make sure her renal function, hemoglobin are okay, and probably coags, since if she has a PE, I'm going to put her on anticoagulation. At this point, she's headed for admission, unless for some reason all of her tests are normal, but we'd still need to educate her because it sure sounds like a slam dunk PE to me.
Great case, medical student, but what are you wearing?
I'm kind of cold, and so this is a Cookie Monster Snuggie. Yeah.